Hi, I'm Mary Henderson, reporting for Daily Bulletin. I'm talking with Dr. Sharmila Duraisamy, a radiology fellow at Brigham and Women's Hospital in Boston. She's sharing key learnings from her RSNA 2024 session, Imaging Utilization of Self-Neglect Mandate Patients in the Emergency Room. Thank you for joining me today.
Thank you for having me, Mary.
Dr. Duraisamy, what did you uncover about imaging utilization related to patients categorized under self-neglect?
Yeah, this is a very important question, and this has not been answered before. So we set out to look for the imaging utilization in these patients, both on index visit when they got their first mandate, and then we also looked at the critical findings on the index visit, and then like on every revisit or the readmissions they had, and when compared to age, race and gender matched control group that presented to the ED in the same time frame, we saw there was more number of imaging studies done both on the index visit and also on the revisits. And the second thing was the number of revisits and readmissions in these patients were high compared to the matched control group. And in spite of all the higher usage of the healthcare and imaging utilization, the mortality in this age group, group was high, like 9 times higher compared to the control group.
What common attributes did members of this patient population share?
Yeah, I would say the most common thing that we saw in patients with the case group was that these self-neglect patients became sick over and over again, and they kept coming to the ED again and again. And the complexity of the issues that they had led them to have more inpatient admissions. So the readmission rate was significantly higher compared to the control group in this subset of patients.
What can radiologists and others in healthcare do to support these vulnerable individuals without further straining system resources?
So this is a fantastic question. I would like to answer this in a different way. Like first we should know what self-neglect is. So we learn, recognize, and then help. So learn about what a self-neglect is, what leads to self-neglect, and what are the different ways a patient can present with a self-neglect. And then educate our radiology and non-radiology colleagues about self-neglect. And then and second is recognize the signs of self-neglect both in the ED and also imaging wise. Like when a patient, it's not an infrequent scene that we see like a pan scan done in a patient like every month, like coming with repeated history of falls, and then we get a pan scan done for every trauma pan scan done like every month. So like when we are reading a study and then we see like this patient is frequently coming, like this may be a good opportunity for us to flag this patient and raise a question that this man have a communication with the provider that this patient may have to be investigated for a self-neglect. Yeah, this puts more pressure on the social worker for sure, but here in where we can take the help of technology to extract information from the EHR to help the social worker in their investigation towards self-neglect of a patient. I think this would help. And also then to help the patient, we should leverage the use of technology like wearable devices, remote monitoring, use of like home hospitals, so that we don't strain the healthcare system. Also, we don't take their autonomy away from them. And so in this way, we can reduce the number of patients with self-neglect mandate and have the help them lead a better quality of life.
Thank you for your time today.
Thank you for having me.
For more information about the study, look for this RSNA 2024 session on demand at rsna.org/meeting central. And as always, you can find more radiology news at rsna.org/bulletin.